So, hi guys, welcome back. Today we're still under the endocrine system, and under the endocrine system, we're going to be talking about disorders of the thyroid gland. So, as you can see on the diagram below, this is an image of where the thyroid is located, basically on the neck, between the larynx and the trachea. We have both the right and the left thyroid glands. So we're going to see complications that affect the thyroid gland. So the thyroid gland is the largest endocrine gland in the humans, and it secretes three hormones which regulate metabolism and play a major role in mental and physical development. So basically, the major disorders of the thyroid gland include hypothyroidism, hyperthyroidism, goiter, and thyroid cancers. So for hypothyroidism, under hypothyroidism, we have cretinism, myxedema, and Hashimoto's disease. While in hyperthyroidism, we have Graves' disease. So you see the presentations of how patients are going to present with hypothyroidism. And in hypothyroidism, the patient is going to have intolerance to cold, receding hairline, facial and eyelid edema, dull blank expression, thick tongue, slow speech, anorexia, brittle nail and hair loss. Patients are going to be lethargic. They're going to present with dry skin, muscle aches, constipation, weight gain, and apathy. While those presenting with hyperthyroidism are going to have intolerance to heat, weight loss, tremors, diarrhea, menstrual changes, facial flushing, enlarged thyroid. They're going to present with tachycardia, breast enlargement, increased systolic pressures. For one to diagnose hyperthyroidism or any thyroid disorder, basically we have to do lab works. And as you can see on the slide below, is that serum levels of TSH normal ranges between 0.4 to 6.15. So we check for the abnormalities in all these lab works. We also have to do a radioactive iodine uptake test to rule out for any thyroid disease, and also fine needle biopsy to rule out for any form of cancerous tumors. They also do a thyroid scan or a radio scan, or also as well as a CT scan to be able to rule out any condition affecting the thyroid gland. So straight we go to cretinism. So cretinism is a condition of severely stunted physical and mental growth, and symptoms the patients usually present with dwarfism, with severe mental defect, and coarse dry skin, deficient hair and teeth, retarded skeletal growth, and reduced basal BMR. So that is basal metabolic rate. And as you can see on the diagram, that's an example of a patient with cretinism. So they present with dwarfism, as you can see, with a bit of deficient hair on the forehead and teeth as well. So that's all about cretinism. So next we go to myxedema. So this is caused by diminished production of thyroxine, and this condition is called myxedema as a gelatinous mixture of glycoprotein and extracellular fluid is deposited in the intracellular space. So superficially, it's on the dermal connective tissues, giving it edematous appearance. So rate of metabolism in all tissues is decreased to a half, and symptomatically, the patient is going to have extremely lethargic and mental sluggish with low pulse rate, dry skin, and coarse hair. In some cases, face may become puffy, and also they have their sex function becoming deprived. So, in that note, we can be able to see an example of how the patient is going to present. So, these are legs of a patient having myxedema, as you can see. So next we go to Hashimoto's thyroiditis. So this is the inflammation of thyroid glands. It is an autoimmune disorder where the antibodies attack the thyroid gland on its own. So symptoms, the patient can present with goiter, fatigue, muscle weakness, and weight gain. So for these patients, most of them are going to have swelling on the neck with a goiter. So next we go to Graves' disease. So Graves' disease is an autoimmune disease where the thyroid is overactive, producing an excessive amount of thyroid hormones. So this is called an autoimmune antibodies to the TSH receptors that activate that TSH receptor. So thereby stimulating thyroid hormone synthesis and secretion and thyroid growth. So symptoms are patient's eyes may look enlarged because the eye muscles swell and push the eyes forward. So weight loss and in patient may present with loss of weight and also increased basal metabolic rate. So I'll show you a diagram of a patient having. So as you can see, the hair is going to become fine. They're going to present with the exophthalmos, where the eye muscles, the eyes get to pop out because of the symptoms that we were talking up earlier on. They're going to present with goiter, muscle wasting, swelling. They're also going to have tachycardia, weight loss. They're going to present with oligomenorrhea. So oligomenorrhea is infrequent periods lasting to up to 35 days. And these patients are also going to present with tremors. So next we go straight up to goiter. So it's a swelling in the thyroid gland, which can lead to a swelling of the neck or larynx, which is the voice box. So goiter usually occurs when the thyroid gland is not functioning properly. And worldwide, the most common cause of goiter is iodine deficiency. So patients with iodine deficiency are basically going to present with a swelling on the neck, which is basically known as goiter. So I'll show you an example. You can see how the swelling gets, how bad it can get. So the swelling affects the entire neck, and this can be very traumatizing to patients and can easily affect their self-esteem. So they are classified in different ways. We have a diffuse goiter, a toxic goiter, and non-toxic goiter. So the diffuse goiter is that which has spread through all of the thyroid, while the toxic goiter refers to a goiter with hyperthyroidism. So these are most commonly due to Graves' disease, but can be caused by inflammation, while non-toxic goiter is associated with normal or low thyroid levels. So we go to how we're going to manage hypothyroidism. So we have hormone replacement. We can adjust insulin and antidiabetic agents as needed. We can also use sedatives or hypnotics courteously. We also do supportive therapy. We have assisting with the ADLs. We also have to monitor the vitals for and cognition of the patient. Also promote comfort and enhance coping mechanism for the patient. So for hyperthyroidism management, so this patient's treatment depends upon underlying cause. You can go pharmacotherapeutic measures or also surgical interventions. So encourage adequate nutrition and fluid balance for the patient, enhance coping and improve self-esteem, maintain normal body temperatures, and also monitor and manage complications in case any arises. So For surgical intervention, the patient can be done something called a thyroidectomy. So for the preoperative care, the patient, we have to prepare a patient who's supposed to go to theater. So we also have to do high caloric intake. You have supplemental vitamins for the patient, avoid stimulants, and also teaching to include demonstrations of how to support the neck postoperatively. So, postoperative care, we also have to assess dressing for drainage. We also have to note complaints of pressure or fullness at incision site. So, thyroidectomy tray at the bedside in case of any emergency. We also have to manage pain. We also have to position the patient in semi-Fowler's position with head being supported on the neck. We also have to do IV fluids and keep items within reach for the patient so that the care can be easily done. So thyroidectomy can also complicate, and some of the complications, the patient may present with hemorrhage. The patient may form an hematoma on the incision site, also edema on the glottis. So injury to recurrent laryngeal nerves because the operation is being done on the neck, and we have so many nerves passing through the neck to access the brain. So there's a high risk of injuring some of the laryngeal nerves. So injury or removal of parathyroid glands can also be another factor. So that's all about disorders of the thyroid gland. Thank you. I hope you've learned something from today. So guys, have a nice day. Thank you. I'll see you next time.